Is pelvic floor dysfunction curable is the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Pelvic Floor Therapy right here in Irvine, Orange County. It's always nice to know when you have a problem, it's curable. So is it curable? I'm gonna say it depends on the extent of it, the length of time you've been waiting to have this looked into. And unfortunately, when it comes to pelvic floor dysfunction, we are looking at pelvic floor equating incontinence or sexual dysfunction or painful intercourse and things like that. What we fail to look at is the connection of the lower back, sacroiliac joint, which are the joints in the back portion of your pelvis, and your hips, your posture, and your breathing. These create any dysfunction in those areas, create dysfunction in pelvic floor dysfunction. So what ends up happening is when those things happen, we don't look at them as there is a connection. So many times we have a history of those things in our medical history, and we're seeing a chiropractor, a physical therapist, a massage therapist. Maybe we're working out and thinking, oh, I'm stretching and I'm strengthening. We don't connect those to pelvic floor dysfunction. So when you talk about pelvic floor dysfunction and if it's curable, it depends, because by the time you actually realize you don't have just incontinence, you have pelvic floor dysfunction, there quite a bit of damage may have taken place. So that takes away the strength and the confidence to say, yes, it's curable. And then you have cases where there is like a nerve issue, that the nerve is actually damaged or the tissue is actually majorly damaged. So then in those cases, it's not curable. But one thing that has to happen is the fact that without proper approach, it is going to be getting worse. So your agenda and your goal changes from curing something to making sure it does not get worse. So if you think you have pelvic floor dysfunction, or you've been told you have pelvic floor dysfunction, use one of the methods of contact in the description box. Contact me. Let's find out where you're at, what's going on, and then you can see what your choices are and what needs to be done. If you have any questions, once again, if you need to make an appointment, use one of the methods of contact in the description box. And if you have not subscribed to the channel, please do so now. And until next time, you take care.